Welcome back to my podcast. My name is Eugene Quinn and you are listening to Cork Matters. Well, hello listeners and welcome back. On this episode, we are discussing taking care actually of your mental health. With us again in studio, I have Catherine O'Grady from the Nirvana Therapy Centre in Limerick. And mentioning of Limerick, actually, well done to the Limerick Rose and winning the Rose of Tralee. So, Catherine, welcome back and thank you for coming in. Look, as we all know how to look after our physical health. But how do we manage our mental health?
Hi, Eugene. Thank you for having me back yet again. I'm getting to be quite a regular here, the Cork Matters magazine. Mental health, we hear it flung around a lot lately, that term. You know, we need to take care of our mental health, we need to get out of our heads, we need to talk to somebody if we're feeling down, and we see a lot of that going around lately. I think that with mental health that we need to have an idea of what actually it means to have good mental health. What are the components of it? What consists of good mental health? What are we trying to achieve when we say strive for good mental health? So we have to ask what is it that we're looking for to get.
Now, you're hitting the point there, Catherine. The components of good mental health. What are they?
I usually work within a certain bracket of what I would consider to be good components. And these would consist of learning to be flexible, adaptive to what's going on around you.
Yeah.
To be energised about life, to have passion, to be interested, have a sense of purpose. And to try to keep our mood stable, which would mean that we wouldn't be too elated and we wouldn't come down too low.
Yeah. And
I also think to strive for good mental health, that means that we have to build up skills which would come under the term of learning to be resilient.
Yeah.
This is what we need to be striving towards in order to achieve good mental health. Yeah. Good mental health is not a given, in my opinion. It's something that we need to work at. And it's something that we need to invest in. And if people begin to notice that their mental health is deteriorating, they really should seek professional help as much and as quickly as possible, because a lot of the times, not all the times, but a lot of the times, they may need a bit of help to get back to where they need to be. Resilience is very important when it comes to mental health. Resilience teaches us inner core skills that will help us to deal with things that come our way in life. And there's nobody here immune from life, and somebody at some time is going to have something thrown at them out of the blue. They're going to struggle with something. They're going to have bereavements. They're going to have diagnoses. They're going to lose jobs, be bullied. They're going to face all of these things or some of these things at some time in their life. And they're not pleasant and they're not easy to face. So it's very important to build up resilient skills for perhaps that will help us if we should face these situations.
Right, okay. You just mentioned there resilience, and you also mentioned investing in your mental health. I'm just going to turn back to that now for a minute. How does one invest in their mental health?
I think by investing in their mental health, what I would consider for an average investment, we say just, to keep yourself some way well, I would begin to look at, in the morning time, setting an intention of how this day is going to go. I would incorporate such practices as getting exercise, meditation. I would be careful of nutrition. I would try to maybe but perhaps reduce as much as possible processed food. I would watch my alcohol intake, and I would make sure to be getting adequate sleep.
Now, resilience is very heavily loaded to a lot of people, right? So, in your own opinion, right now, from your professional perspective, how does one practice resilience?
Very briefly, and it would take a long time for me to explain it here, but how I would see it is that somehow or other we begin to grow for ourselves an inner champion or an inner mentor.
Yeah.
which means that we grow for ourselves in our inner life, somebody that's on our side, somebody that has compassion, and somebody that would invest in skills such as building confidence, building esteem, learning to take risks, and if they fail, we're on our own side. We would also be building up maybe a particular physical strength in that we would be trying to get ourselves somewhere fit, so that we're, fit in mind and body. So resilience really is about learning to build up an inner champion for whatever that may be for somebody else. Somebody's on their side that's going to help them see them through this thing.
Yeah. Now, you also mentioned it, like, or is that just a myth?
Absolutely the truth.
Yeah.
Absolutely the truth.
Yeah. So a lot of people who go through mental health issues, right? Be it depression, anxiety, trauma, whatever the case may be, their physical person can also suffer.
Absolutely, and you see it all the time that people that would be suffering from mental health, they may not sleep at night, for example, simple thing. They may not sleep, and in other cases some people might find it very difficult to get up out of bed. Some people might eat too much and some people might not eat at all. Some people will have a very flat mood, and other people might become quite elated, highly strung, full of anxiety.
Right. Look, Catherine, you've actually brought a lot of subjects and a lot of points there together, right, in one go, right? So what I'm going to say to you is, right, there's a lot to be taken in what you said. So could you just put a summary on what you said?
As I said, mental health, good mental health is not a given. We have to work at it, we have to invest in it, we have to mind it and take care of it. And I think if we see people that are beginning to act differently and become withdrawn or isolated, or their energy is becoming a bit flat, we need to take notice, because a very relevant and real component of good mental health is that we connect with other people, that we don't isolate.
Very good, Catherine. Thank you very much for coming in. Now, before I go off air, ladies and gentlemen, I'd just like to give you out the following details, right? Catherine has a website and it's www.nirvanatherapycentre.com. Now, you can also Google search Eating Disorders Limerick, and it also redirects you to nirvanatherapycentre.com. Her phone number is 086 19 53537. That's 086 19 53537. Good morning, Catherine, and thank you very much for coming in and giving us such great insight.
No.